This week, Nation's Business looks at how the Ministry of Health is working towards ensuring that all Fijians have access to better improved health services. Investment in health is an essential priority to the growth of a nation, and it's because of this commitment that the ministry is working towards providing affordable, accessible, and high-quality health services to all Fijians. With a budget of $158 million, the Ministry of Health is confident that its allocation for 2014 will cater for the growing number of projects targeted for the year.
We are in the midst of a $9.5 million renovation, just under $10 million, and this will mean 4 new operating theatres in the East Wing. That will take our capability up to 8 of brand new international level operating theatres, and 2 of these operating theatres will be earmarked for neurosurgery and open heart surgery.
Dr. Sharma said the 2014 budget will have an impact on the Health Ministry's vision to equip doctors and nurses with better upgraded equipment, in addition towards improving customer service for the general public and more medicinal drugs for patients.
So, what we need is a modern facility with, top of the range technology, and it needs to be adequately staffed and be able to provide an improved level of health care to our people. With that in mind, what has happened is we have developed a new emergency department, and a new emergency department carries a lot more immediate support to patients who come in collapsed or traumatized in motor vehicle accidents, suffering from acute medical conditions like myocardial infarct or acute asthma or bleeding internally. So what happens is there's a lot more effective management with ventilatory support, improved trained personnel. Doctors have undergone training in emergency medicine, and some of the nurses have undergone training in the elite nurses group.
Already, workshops targeted at improving the capacity of all medical practitioners have and continue to take place, all part of ensuring that medical facilities and services are brought closer to the public.
We have changed the laboratory, general lab facilities at CWF. It's been totally modernized, and it has now linked by a information system with all the labs throughout Fiji, so that reports can be sent and transferred in the interest of patient safety and getting results to patients a lot more effectively.
In working towards guaranteeing that healthcare is easily accessible to all Fijians, including those living in the rural remote areas, a total of $4.9 million has been set aside for the continued refurbishment of CWM's hospitals and operating theatres throughout the country. These additional operating theatres will be of international standards and is expected to cater for a wide range of specialist surgical procedures, such as joint replacement, open heart cardiac surgery, and for the first time, neurosurgical procedures and organ transplant.
We have started open heart surgery along with our visiting teams from abroad. This year, very few patients have gone abroad for open heart surgery. All of it has been undertaken in Fiji, in Suva, with the support of the Sahedri team. We have the Australian team and the New Zealand team coming in to do the balance.
Nation's Business followed a group of surgeons from the Sahyadri Hospital in India who conducted surgeries in the field of joint replacement, neuro and open heart surgery. This is the first time that such surgeries have been conducted in Fiji at affordable costs, since patients will benefit from cheaper treatment and for the first time would not have to travel to India for surgeries.
In fact, I went for cardio artery bypass graft. I got 3 blockage, and I'm very thankful to the Ministry of Health and the very qualified surgeons from the Sadri hospital. They carried out the surgery very well, and I think so far, to my knowledge, it is 100% success.
For Manjula Murthy, the heart surgery is a dream come true, since this expensive surgery has been done here locally by heart surgeons from India, and that these surgeons are also training local medical practitioners.
We really appreciate them by doing this. Like everybody cannot go to India, right? And they are very good and it's very successful. And thank you so much for bringing them here. We thank Ministry for Health for doing this. Service perfect, very good, very good. We'll tell everybody about this. It was very well done.
More than 16 surgeries in open heart were performed, with 10 neurosurgeries and 14 surgeries performed on joint replacement in Lautoka. For Usha of Lenga Lenga in Nandi, the joint replacement is a dream come true, given that life is more easier. She is one of the 14 patients that underwent hip replacement surgery.
I had a hip problem. So my hip was deteriorating. So I was advised by these local doctors to see this visiting team, orthopedic team. So when they were here, I was called by them to come and see them. And when I met the surgeon, he took my X-ray, did MRI, and then he found out what was wrong with me and asked me to have the operation. But that thing could only be fixed by operating, no other medication.
Similar sentiments were also felt by 49-year-old Roshni Chand, who underwent hip surgery and is now able to move around without much difficulty.
Yeah, this is a very good team, and I like them. No, there wasn't any problem. Even the nurse from these hospitals are very nice. They help us too much.
The project coordinator says the success rate of all their operations in Fiji has been 100%. These surgeries were also conducted at the Lautoka Hospital and are part of the improved services that the Ministry of Health is working towards.
The patients over here are very much sincere enough to do all the physiotherapy, and they follow very good instructions, and they are good patients. Only thing that basically the joints what we have operated here, both in the knees as well as the hips, they are of very complex variety, and they were in grade 4 of osteoarthritis. So these kind of complex surgeries, coming here and performing them was of a great experience, great thing to do, and the ministry has helped us a lot in all these things.
The Minister for Health, Dr. Neil Sharma, says with all these developments happening in the health sector, the ministry is working tirelessly in preventing the rise in non-communicable diseases. He says the onus also lies on everyone to take responsibility for their health.
So we are living very stressful lives. We are consuming the wrong types of foods, and as part of our habits, we are now suffering from these diseases. We have premature death, and as a result, we continuously talk about the risks we carry, that we're leaving behind orphans and widows, and people are not even living to enjoy their superannuation or FNPF pension. So it's important that we take a stand. So people need to commit themselves to what they're doing. They must believe in themselves.
To assist individuals who live with non-communicable diseases, the Ministry of Health has set up diabetic hubs in all subdivisional hospitals.
We have gone up from a $164 million budget to $222 million. So the operational budget, we are right-sizing our doctor and nurse population and the allied health profession, and we're looking at rationalizing our government worker wage earners, and at the same time ensuring that the vehicles and all these other things are working well. We have set up the diabetic hubs that will then go down the line to the subdivisional hospitals, and our NCD bus. There's a distinct possibility that we will put in an NCD bus into the north.
At the same time, the ministry is providing free prosthetic limbs to enable those to continue to lead a normal life.
The government has set up a prosthetic unit. We built a prosthetic unit, and it's fully operational. There was a team here which came from India which supported our local boys to learn, and over 300 cases of amputation, lower limb amputation was taken.
These are all part of ensuring that members of the public have access to better and affordable medical services. Better improved services is beginning to take shape this year, with a number of major infrastructural upgrades taking shape right across the country.
Hospitals are, are being upgraded. We're putting in a new maternity unit, a child health clinic in Singatoka, bringing in the health inspectors there. You've got certain health centers being developed along Duvu, a new health center, nursing health center. And there's a few other health centers which are being being commissioned through the support of the provincial, division or the Ministry of Rural Affairs.
In total, $7.3 million has been set aside for the first phase of construction for the new 55-bed hospital in Ba. $2 million for a new hospital in Nausori, as well as $250,000 for the establishment of a new health center in Naulu. $5.9 million has been set aside for the Lautoka Hospital Emergency Department, $1 million for the Keasi and Valelevu Health Center, $2.4 million for the Nangatangata Nursing Station, Langi Health Center, Vuvu and Waivaka Health Center, $3 million for the upgrade and maintenance of urban hospitals. These major investments in health infrastructure will support government's efforts to decentralize and improve accessibility to health services around the country. For most part, many had seen an improved service given that the focus has changed to that of ensuring that people are provided with accessibility to better and improved health services, a human right and a step towards Fiji attaining one of the Millennium Development Goals.
But whatever it is, they are all our people. We've got to look after them, and within the limitations we have, we are doing our level best.